Some health and safety experts are urging people to stop taking a popular herbal supplement used to treat pain and other ailments. Problem solver Connie Thompson has what you should know about Kratom and why federal regulators are now considering a ban. Connie?
Yes, they are. Kratom is a plant-based supplement reportedly used by millions of Americans as a natural reliever for pain, anxiety, depression, and even opioid withdrawal. But the Food and Drug Administration says Kratom is actually an addictive opioid itself, and federal regulators want you to steer clear. For decades in Southeast Asia, the leaves of the kratom tree have been used to treat aches and pains. Here in the United States, you can buy kratom over the counter in the form of a powder, pill, or tea. According to the American Kratom Association, 3 to 5 million people in this country have used kratom products.
The research that's been done indicates that people are using kratom to help alleviate chronic pain, to treat mood disorders like anxiety and depression, and in some cases to help wean themselves off of opioids.
But the FDA says kratom itself is an opioid. The FDA warns it can be dangerous and even fatal, saying it's associated with more than 3 dozen deaths. The Centers for Disease Control says kratom may be tied to recent salmonella outbreaks. The CDC recommends kratom should not be consumed in any form. Consumer Reports also has concerns because, like all supplements, kratom is not regulated.
Any given kratom product can be grossly mislabeled. It can be laced with other substances, including illegal drugs or prescription medications, and it can interact with other medications that you're taking in ways that are really dangerous.
Right now, the Drug Enforcement Agency lists kratom as a drug and chemical of concern, but DEA could reclassify kratom to the same category as heroin, LSD, and ecstasy, essentially banning it for consumers. The American Kratom Association argues making kratom illegal could drive more people to prescription painkillers or illegal drugs to treat their symptoms. The organization says it supports appropriate FDA regulations to ensure the safety and purity of kratom, but not a ban. The DEA is reviewing data and public comments.
But it could still be several months to a few years before they render a decision. And in the meantime, Consumer Reports really feels that given the lack of regulations, it's better for consumers to avoid this product altogether.
If you're trying to avoid prescription painkillers, Consumer Reports says talk to your doctor about all the possible options, including therapies like acupuncture. As the DEA decides what to do about kratom on the federal level, a number of states and cities are banning kratom supplements because of the safety concerns. By the way, Washington State so far is not among them. Back to you.
Connie, thank you.